everyone, I'm Dr. Parul, and in this video I'm going to take up two queries of our clients. So first query is that, doctor, I'm using a product but it's not showing me a glow. Second query is that how soon should I start preparing my skin if I have an event or a wedding a few months away. So let me tell you, if you're looking at a very superlative glow, shiny, glossy and a sustainable glow of the skin, it doesn't come easily, it takes time. And second, it doesn't arise from one layer of the skin. That means one treatment or one single session doesn't suffice. I'll explain it to you how. I call these as 5 levels of glow. These are 5 factors which we need to really suffice. Now the first level of the glow is the most superficial surface of the skin that actually has accumulated stacked layers of dead cells. Now these dead cells have to be expelled so that the new live cells, which are more hydrated, which are more rounder, surface up, and that's how the glow comes. So this you can do by glycolic and salicylic based preparations or treatments like chemical peels. The second level of the glow is the hydration barrier or the moisturization barrier. Now I have emphasized it enough in all my videos that moisturization is a must, even if you have an oily skin, acne prone skin, or for that matter very dry or a flaky skin also, because that nourishment has to be done repeatedly, and you can take help of your doctor to know what appropriate moisturizer would suit you. Like it may have squalene, your shea butter, oatmeal, hyaluronic acid, etc. Hyaluronic acid basically is the newest compound, and it is used as a compound in many of these vitamin C serums so that it is nourished. And hyaluronic acid use, if we need a very extended or a very extensive glow, then hyaluronic injections are also given. That's the principle of the filler injections which we do. Now the third level of the glow is redness or erythema. Now for any reason like your acne, rosacea, you have inflammation in the skin, means redness. There's a lot of blood vessel dilatation, there's a lot of movement of the cells, there's a lot of water collection, and the skin is undergoing a trauma and a repair. In this all situation, there is obscuring of the glow. The glow is not visible, obviously, because the skin is undergoing an injury and a repair process. It takes time for that to reduce. So if you have any of these conditions, the doctor will need time for the skin to settle it down, for the redness to go down, and to get your skin back to normal, and then work on the glow part of it. So you have to use medications to reduce them. You can use products like your niacinamide, azelaic acid to settle the skin down. And these are like repair agents which will be incorporated in your skin regime if you have redness. The fourth level of the glow is the color. Now we have ample of pigmentation, we have ample of chances to get pigmentation. So 2 hours of shopping, 2 days of Goa is enough to give you 2 days of pigmentation, 2 layers of pigmentation over, that's called as suntan. Then you have hormonal pigmentation, which is on ear and ear, can be on the neck. Then you have an internal pigmentation which leads to excess or deeper pigmentation. Then you have post acne pigmentation. There are no less reasons to it. Pigmentation means there is excess color in the skin, and this needs to be diluted by using demelanizing agents like your hydroquinone, kojic acid, vitamin C, arbutin, etc. and treatments like your chemical peels, your deeper peels, and many of the lasers which help in diluting the pigmentation. So if this factor, that if you have patchy pigmentation all over, definitely the glow is not going to be there, and it will take time for a doctor to reduce this, because it takes multiple sessions of chemical peels to reduce and attain that real flawless skin. The fifth level of the pigmentation, the fifth level of the glow, is the collagen. That's much deeper down in the skin. Now this collagen layer is basically the layer which maintains the integrity, which calls the integrity and the structure of the skin, the tensile strength of the skin. Now with age and time, the collagen reduces, the strength of the collagen reduces, and that's where you get the fine lines and wrinkles. Now if you have fine lines and wrinkles, definitely the skin will not glow. So you need a repeat renewal, you need collagen building with many treatments like your MNRF, Thermage, HIFU, and many more treatments which can actually build up. Many products can prevent collagen degradation, like your sunscreen, which you should start much early in life, and also collagen building products like your collagen supplements, peptides, retinoids, etc. So if you see, out of all these factors, even if one is deficient, you will definitely not get the desired glow. And that is also the reason, if you are using only one product, you may not attain a sustainable glow, and we need about 3 to 6 months, if possible, in advance, before any main function which you have in your requirement. Now I think that solves both the queries well, and still if any questions, you can always drop us a question and we'll help you to answer them. I hope that was much awakening. So start with it, start early, and now you know the 5 levels of the glow. Thank you.